Ate,
Kasi
wait
nga,
lang
mga
po.
Irish yung mga, hi, Zach!
Sorry. Cut, cut!
What's up you guys, welcome back to my channel. If you are new to my channel, please don't forget to subscribe, turn on the notification bell for you to get updated for all my future uploads. By the way, my name is Raymond, your Pinoy nurse here in Ireland. Alright, team, what's up? Hello! Kumusta naman kayo dyan? Before anything else, I'd like to thank all of you sa lahat ng mga supporters ko dyan, sa lahat ng mga subscribers for continuous support in my channel. Maraming salamat, especially for the good reception to this series, Nurse in Action. Thank you so much from the bottom of my heart. Yes! Alright guys, so this is another episode of our series, Nurse in Action, wherein we put the spotlight to those nurses who are working here in Ireland for them to share the experience in their workplace and of course to give you an insight, an idea how is it working here in Ireland. Guys, we have done different departments already and please comment down below whatever department you want me to do next, okay? Alright, so today we are going to talk about community health nursing, specifically pediatric. So without further ado, let's meet our special guest.
Alright guys, so once again, as I mentioned earlier, we will be joined by one of the community health nurse dito sa Ireland, specifically sa pediatric nursing siya. She is Gieceree Gonzales. Hi ma'am! Kumusta?
Hi, Mon! Ma'am ka dyan. Jack.
She is known as Jack and she is a YouTuber, guys. Please support this wonderful woman.
Thank you, Mon. Thank you,
Okay?
everyone.
So, sweeter than honey. Okay? Sweeter than honey yung kanyang YouTube channel. Ate Jack, kumusta po?
Ayos naman ito. I'm preparing for work na naman kasi night shift nurse ako.
Okay.
I'm basically working as a community pediatric nurses. Ang cases ko is like complex care patients. I've been here since January to this year. When I'm 34 years old, tanda na. Matanda na rin ako bago nakarating dito sa Ireland. It was my 2006 dream, but
Okay.
I arrived here in 2020. So guys, may pag-asa pa.
It's never too late.
Yeah.
Yes. So Ate Jack, I just want to ask, so taga saan ka sa atin sa Pilipinas?
I'm from Zamboanga City.
Zamboanga.
And I just spent around 1 year in Zamboanga, earned my experience there in a primary hospital. Then before I reached the age of 22, I grabbed the opportunity to work in Saudi Arabia. I worked first in a polyclinic and then followed by a hospital in the outpatient department. Previous employer that I had was in a Ministry of Health tertiary hospital. So I was there for Saudi Arabia was my home for the last long years.
Oh,
Doon ako
my.
nag-asawa, nag-anak, doon na lahat.
Yes. Napakahabang
12
panahon yun, guys. Ako, I spent 5 years working in Saudi Arabia before. So 12 years really like remarkable.
There are 10 turn of events in life that
Yes.
like make you grateful na somehow nakarating rin.
Oo nga.
It was not my priority, may iba akong pinrioritize, so nawala siya. And recently with the crisis happening in Saudi Arabia, with the taxes and levy put on our dependents, it was my turning point, my greatest motivation to really pursue the exams and all.
Yes, and congratulations. At least nandito ka na after,
Yeah,
it's
kaya
like
nga, after many trials in English
Yeah.
exam.
Sige, pag-uusapan natin yan later on. So ate, 12 years in Saudi Arabia. So which department you worked there before coming here?
So for the last 2 years, I worked in pediatric ward.
Pediatric.
And then the moment that I passed occupational English test, I immediately requested to transfer in a pediatric intensive care unit
Okay.
para mas maka-earn pa ako. Kasi nga,
Yes.
ang vision ko, I need to earn experience kahit maliit lang, pero at least I will know how to handle like critical patients.
Yes.
Lang, para pagandahin lang ang CV ba?
Yes. So guys, yung initiative and if you want something, di ba? Gagawa mo talaga ng paraan. And I'm so proud of
Gagawin mo
you.
ng
ate.
paraan. Kahit takot ako kasi may mga naririnig ako na parang terror yung head nurse or something like that. I found out that she was really great, very supportive with the staff.
And you know what, ate, this is a very good opportunity, lalo na sa mga subscribers natin. What we are doing right now is part of our series, Nurse in Action. And this is really good kasi lahat ng mga na-feature ko for the past episodes, were working in the hospital. Now, community health nursing. So how did you apply for that? So paano ka napunta sa community?
Community nursing is mas kilala sa atin na home care. We're giving our services in the comfort of the home of our clients. Actually, nakuha ko itong opportunity na ito sa Filipino nurses in Ireland na close group.
Yeah,
So
okay.
doon ko nakuha ang employer na to kasi we're like, there are people there are very generous to share na, uy, may hiring sa ganito, may hiring
Yes.
sa ganyan. Whatever they share in that group, kung may hiring, send kagad ako CV,
TV.
ganyan. Kasi I was still awaiting for the decision letter at that time. So wala pa akong DL noon nung nag-apply ako sa employer ko ngayon.
Okay.
So nag-send lang ako ng CV and then like after a week I was called for an interview. So they gave us a month, they gave us some points to na parang kailangan naming pag-aralan, ganon. Nagbibigay sila ng tips yung consultant agent
Yes,
ng
before the
nagbibigay
interview,
sila niyan.
which is
So
good.
hindi nila tayo papababayaan. Yung mga
Correct.
consultant agent ng mga agency, they gave us points para maging successful tayo sa interview. So wala tayong dapat katakutan. Siguro, konti lang experience mo, hindi mo masyadong gamay,
Mhm.
just be honest. Kasi
Yes.
dito naman, we have training. If you're being honest, they would really appreciate that and they will give you further trainings for that.
Yung age
Mhm.
range, anong age ang pediatric dito?
Until 16 years old.
16 years
We have
old.
as much as older as 16 years old. So
Weeks
parang
old, parang
covered din niya
practice.
yung parang neonatal.
Yes,
Parang
yun na
something
nga.
like
Yun na
that.
nga sasabihin ko sana. Oo.
Uh-uh.
Tapos, ate, since you mentioned already your, like, the overview of your duty, how is your typical day? How is the roster? Paano ka nag-start ng duty mo?
Given na kailangan kong mag-travel, lahat naman tayo nagta-travel, but for us, pwede kaming ilagay kahit saan. So may
Okay.
time na talagang long ang travel ko, like, because wala pa naman akong car, nagda-Dublin bus ako.
Okay.
So, ang minsan biyahe ko mga 1 hour, 2 hours, yun yung downside ng community nursing. Kasi may possibility na pwede kang ilagay to different towns and you need really to know to make your way how to travel. So, ang best friend ko, at dito ko natutunan si Google Map. Dito ko natutunan na alam mo yung car na nasa Google Map, nag-move pala yun. Sabi ko, uy,
Nagmo-move,
amazing. Sabi ko, nag-move pala tong car dito sa Google Map. It does not happen all the time na long ang travel. It depends kung saan ako nilagay. So, pagkarating ko naman doon, I'll get the endorsement from the parents. It's either the mom or the dad. Because parents ng mga batang ito, they are well trained by the HSE. So, I receive the care from them because they are considered as the primary carer. And then right after that, I'll start with my, like safety checklist. Check ko kung safe ang pasyente ko, kung okay ba yung bed niya, okay pa bang zipper, kasi usually sa kanila sa crib or sa bed na naka-zip.
Okay.
Check ko kung ang mga equipments ba ay properly functioning, naka-charge ba, ready to be used ba, in case of emergency, mga ganon.
Mhm.
Tapos, after that, may oral medications, kasi oral lang naman kami, oral.
Okay. Walang
Pero
intravenous
via
medication.
peg. Magpapalit ka ng diaper, ganon, tapos in the morning, you'll give another feed and they give oral med. And then in between, monitoring lang talaga. Mostly sa kanila, sila, may mga congenital anomalies sila. So,
Okay.
prone sila sa seizures. Greatest care namin is to monitor them very well while they are asleep. Tapos hindi kami ang nagpapaligo sa pasyente, it's the parents.
Oh, okay.
Yes, pati yung pagpapalit ng mga
Yeah,
linen sa kama.
hindi
You're the
masyadong
one
dependent
doing
sa
it,
nurses.
but if you want to do it yourself, kasi nga siguro naihian or may nag-leak sa diaper, pwede mo namang palitan. Pero yung obligatory ka na magpalit every shift, no, it's the parents. Pati paligo sila. So very light
see.
lang ang trabaho actually.
You mentioned earlier about sa duty mo. Anong oras ka nag-start ng duty? Lagi ka bang morning shift or day or night shift?
Solely night shift ako. So usually
Okay.
ang start ng duty ko 11 p.m. 11 p.m. until 7. So it's usually 8 to 9 hours.
So usually ang schedule mo, paano siya nangyari? Mga four nights ka and then how many days off? How it goes usually?
Yung randomized siya masyado. Depende din siguro dun sa mga karelyebo ko, yung mga kasama ko sa shift na yun. I usually have 5 days in a week and I could have also 3 days in a week. So depende lang. In our company, we need to at least accumulate 156 hours in a month.
156 lang? Wow!
Yeah, so 39 hours lang naman talaga weekly dito ang allowed, diba, by law?
Correct. Medyo magaan din kasi kung mga 8 to 9 hours lang.
Oo, no? Hindi ka pagod at saka mostly tulog ang bata kasi. And we are allowed to use our cellphone as well. Hindi bawal, pero wag lang calling.
Siyempre, naman.
Wala lang calling.
Kasi nasa duty ka pa rin, guys. Nasa trabaho pa rin tayo. Ate, curious lang ako kasi you mentioned earlier that you were receiving like an endorsement from the parents, no? How would you know na yung pasyente mo is in this town or how would you know that your patient will be this kind of patient, is it being allocated by your company? Paano nangyari yun ate?
Bago kami dalhin sa patient na yon, they'll make sure that trained na kami. Example, kung may tracheostomy ang pasyente, prior
So
that,
kailangan, yes.
so kailangan mag-training muna kami. So sa company namin, meron kaming pediatric academy courses. So it's we're being trained by educators from Temple Street Hospital. Tapos on our first day of our duty with that patient, we have some shadowing. Kung hindi ang clinical nurse
Okay.
manager, it would be the senior.
Just follow-up question, ate, regarding your allocation of duties. So in a month ba, you have certain number of patients that you will handle, or same patient for like a week, 2 weeks, or it depends really?
So sa case ko, it varied. For the last 8 months, I was fixed to one patient only here in Tala.
Okay.
Yes. But then after that, mayroong mga nag-leave sa Donegal. So pumunta naman ako ng Donegal, nag-cover ako ng nag-annual leave.
Yes,
I-expect mo
oo.
talaga na iikot ka. Sabi ko nga sa mga kasama ko, pwede na ata akong mag-tour guide. Enjoyable siya actually kasi makakakita ka ng ibang lugar aside sa lugar kung saan ka
Yes.
nakatira.
Totoo. Ang mga pasyente mo nasa bahay, how would you refer? For example, there's like untoward incident, yung mga referrals sa mga doctors.
So yung protocol namin dyan, since the parents is the primary care, example, let's say 40 degrees ang temperature
Yes,
ng pasyente. After all the nursing interventions, sponge bath, medications, paracetamol, like routinely, and after all, hindi pa rin nag-subside. So we will ask the parent that they will also take our advice na what are we going to take our kid now to the hospital. So the parent and you, the nurse, will agree with each other kung anong gagawin.
Okay.
And then we will also call our clinical nurse manager kasi siya din ang pinaka may say sa decision making. So it's very different kasi sa hospital, di ba, pag nasa intensive care ka or nasa ward ka, doktor ka agad kausap mo.
Exactly.
Dito, parent ka. Parent ang primary carer. Tapos, clinical nurse manager. Wala kang connection sa doktor. Ang may connection sa doktor ang magulang. Multidisciplinary ang magde-decide. CNM, ang magulang,
Parents.
kasama sila sa multidisciplinary team, tsaka
Saka yung
ikaw.
assessment mo din.
Pero
Yes,
after all the interventions that you have given.
You mentioned earlier about patients with tracheostomy, with peg tube. Ano pong mga cases na handle mo so far?
Kailan, kunin ko lang yung notebook ko.
Sige te, sige.
Kasi ang hirap ng mga nila, as in Patho syndrome, hindi ko ba paano ba yan? Paano ba i-pronounce yan? Patho syndrome, tapos multiple sulfatase deficiency, Beckwith, Wiedemann syndrome, infantile migration of epilepsy syndrome. So these are just some of the cases that I had handled na dito ko lang din na-meet sa Ireland. So rare condition sila.
And this actually proves that, nursing is really a continuous process and learning. Kasi itong mga to, napag-aralan natin, nabasa natin somewhere. Siyempre, kailangan aware ka
din. At saka dito, ang maganda sa mga care plan dito, ang mga ganda sa care plan, pagkagagawa nilang care plan dito, very specific. Sometimes I laugh at myself when I read the care plan because it's not us to do the care plan, it's the CNM. Minsan, sing lullaby songs, very specific, like, nandun na lahat sa care plan kung anong pwede mong gawin sa bata. Ganon. Talk to the patient kasi gusto nila kahit mga intellectually disabled ang mga bata, you would really want you to make a conversation with them. Importante yun sa kanila. Di ba may mga school pa nga sila dito sa mga intellectually disabled?
Correct.
And these services are being paid by the government. Walang nasi-shell out sa bulsa ng magulang.
Itong trabaho mo ate, is this yung agency mo, is this under HSE then?
You know that the agency is funded by HSE.
So
ang sweldo okay naman, pero hindi siya talaga yung HSE pay scale.
Okay.
So parang may pagka-subcontract siya. Inisip ko na lang makarating dito ng Ireland, yun naman ang sabi ko sa sarili ko eh.
Naman.
Sabi ko, and then choose after 2 years. Kung hindi mo talaga nagustuhan yung employer, then di ka happy, then after 2 years, then go, get another one. So far naman, happy naman ako kasi from day one naman, they're very, they listen to us kung may mga suggestions kami, and they have feedbacks, like positive feedback.
I just want to ask, ano yung major adjustments mo when you were starting?
First, yung weather. When I arrived here, very, very cold kasi parang winter pa siya. So,
yes. Totoo.
Tapos sabi ko, bakit alas 9 na ng umaga? Bakit madilim pa dito? Tapos nasa Malahide kami, nasa coastal area. Second is travel long hours. Sa Saudi Arabia, sanay ako na yung hospital na pinapasukan ko, nasa harapan lang.
Okay.
Nasa harapan lang yung hospital.
Okay.
dito
Okay.
kailangan mo magbiyahe ng medyo matagal at saka hanapin yung bahay. So, na-experience ko yung mawala or lumampas sa bus stops. Uy, paghanap mo ng bahay, kaninong bahay kaya ang papasukin ko nito? Pareho lang ng mga pintuan, pareho ng kulay, pareho ng itsura ng bahay.
Yes.
Alam mo yun, ganun. So, minsan nakakadoorbell ka ng maling bahay. Yan.
Meron ba kayong parang central office, yung parang hospital kung saan nakita-kita kayong mga community health nurse?
For now, wala talaga kaming facility na parang training lang talaga, training ground lang namin office dito sa
Okay.
Dublin. Another downside is wala kang mga kasama sa trabaho, less socialization ba.
Socialization.
Ah,
So how about communication natin? Did you have any problem with that?
yes, sa communication naman during our trainings, yung mga Irish namin medyo fast-pacing sila ba magsalita.
Yes.
So,
Totoo.
sinasabihan nila kami from the start pa lang na, uy, pag mabilis na kami at di nyo na kami nagigets, please lang, ha, magsabi kayo na, kindly please slow down. Ano yung English na walang
Parang
period?
dire-diretso, no?
Yung, yung English na walang period, pag nagano na sila, sabihin namin, Mom, I'm so sorry we did not get it. Can you please repeat it for us?
I just want to ask, ate, regarding the compensation. I'm not gonna ask your salary kung how much, no? Pero may extra allowance ba, for example, for the transportation or a meal allowance kung kasama ba yun sa duty mo?
So sa amin, pag day shift, iba ang rate sa night shift. So mas
Okay.
higher ang night shift. Ang holidays namin, meron kaming bank holidays at saka Sundays. Meron siyang certain amount na ina-add pa sila. Pero transportation allowance yan ang wala kami.
We were talking about COVID, or how did it affect your job as a home care nurse during COVID?
Example, may colleague ako na na-expose yung pasyente ko sa
Mhm.
kanya. Nag-positive
Okay.
siya. So, I cannot report to work not until a swabbing is done to the patient and to the family. So, that means na kailangan ko munang huwag pumunta sa trabaho. So, it means cut hours ako. Loss yun sa part ko. Pero, at the same time, isipin mo na lang, beneficial din naman yun sa part mo.
Pag nandun ka na sa bahay atin, no need naman for mask, lalo na ngayon, di ba? Dahil nire-require na yung mga mask. Hindi ka naman kailangan naka-PPE.
Suspected of COVID positive ang pasyente, naka-gown kami. Tsaka naka-N95 respirator.
I just want to ask, ate, regarding the differences in practice. Siyempre, 12 years ka sa Saudi Arabia.
So, pagdating dito, isa na lang pasyente ko, tapos tulog pa most of the time. So, sabi ko, ang saya-saya naman ito. Sinasabihan ko nga mga kasama ko dun sa Saudi, uy, hindi na kayo dito. Mas lighter talaga ang work ko ngayon. And I'm enjoying it. I'm enjoying it actually.
Yes. Curious lang ako. Sorry kung nagja-jump ako. Paano yung documentation mo pala?
Yung yung documentation namin, very few lang. Check lang namin yung safety checklist, input-output. Evaluation chart ang tawag nila sa nurses notes dito.
Yung evaluation notes, kinikip na yun sa pasyente?
Doon lang ka. May file talaga kami doon. Kasi chinecheck yun ng HSE from time to time.
And yung handover, ate? Kunwari, pag outgoing ka na?
Wala nang handover. Ano na lang, verbalization lang. Makikipag-usap ka lang sa magulang. Uy, nakatulog naman si John ngayong gabi. Hanggang ganitong oras, nagising siya, let's say, alas 5. Nagpupo naman siya sa akin. Mga ganun lang.
Magaan lang talaga siya.
Magaan lang talaga. Super gaan.
I just want to ask, since almost a year ka na dito, sa January, mag-1 year ka na. My God, congratulations, di ba? So far, how did Ireland change your life? Marami na bang ipon? Si Nurse Jack?
yun ang masaklak. Ang Pilipino, hirap mag-ipon.
Okay.
Because, we have extended families to support,
Okay.
Pero meron naman at saka kahit papaano may naipong kapiranggot tapos may counting project sa Pilipinas. Less ka lang sa mga online shopping, live below the means or within the means na lang para makapag-ipon kahit papaano.
Aside sa naiipon natin, yung professional growth.
Yan ang isa sa masaya ako kasi nga dito may continuous ang training dito. So marami kang matututunan na skills, knowledge. And then meron tayong HSE land, yung gusto ko yung HSE land kasi nga libre ang mga yun, and then you really have the certificates.
Yeah, and it's up to date, guys.
And I'm happy na dito kasi later on, pwede kang mag-aral.
You know what, ate? Maraming aspiring nurses. YouTuber ka din, ang dami nagtatanong how to, come here and all the process and all. So what are the tips and advice that you can give sa mga aspirants natin?
Ang iba kasi nanghihinayang mag-spend ng pera. na
Mm.
alam mo yun, ang mahal-mahal ng OET, magkano ang OET, magkano ang IELTS, 'di ba? Super mahal.
Yes.
Tapos buti sana kung nakuha mo ng one sitting lang kasi one sitting
Yes,
lang naman
oo.
talaga dito sa Ireland, hindi ka pwedeng mag-clubbing ng scores. Sabi ko, take me as an example. Sabi ko, nakatatlong IELTS nga ako, 'di ba? Sabi ko nga sa inyo, tapos sa OET ako pumasa, 'di ba? Sabi ko,
Mhm.
but every time I fail, I take them as na nag-invest ako sa future. So, dapat di
Correct.
ako nangihinayang. Kahit mahirap i-juggle yung work at saka yung studying kasi kailangan mong mag-aral para sa
Preparation
interview,
talaga.
kailangan mong mag-aral para sa, let's say, mag-RCSI aptitude test ka, kailangan mong mag-aral para sa English exam. Ano ka lang ng discipline talaga na kubangon ako para mag-aral. Pupunta talaga akong library, nag-aaral talaga ako doon. Na wag na muna silang umuwi ng Pilipinas. Mag-cross country na lang sila gaya ng ginawa ko. Hindi talaga ako umuwi kahit miss na miss ko na ang anak ko.
2 years
Last
na.
year na nakita ko ang anak ko, December
20
2018. I'm grateful
Mm.
kasi may family reunification joint visa
Reunification,
naman.
yes.
So next year, they
Yeah,
will be with
process
me na.
natin yan in Jesus'
Yeah.
name.
Pinapanood ko yung yung
Yung
series mo
series
eh.
ko din. Tama yung sinabi ni Ate Jack, guys, that if you really have a dream, you really just need to chase it. Most of the nurses and most of the people, actually, not only nurses, they're afraid to go out of their comfort zone without knowing na, uy, mas okay naman pala na ganito, yung ganyan. Alam mo yun? I mentioned earlier at the beginning of this episode na you are a YouTuber. You can promote it. Ate, I will support your channel. Sabi niya. Yes.
Yay! Hello po sa lahat ng subscriber ni Nurse Raymond. Please makisubscribe din kayo sa channel ko. It's called Sweeter Than Honey. Actually, nagpo-post ako sa Filipino nurses in Ireland.
Yes, ate. Bang nature ng ng YouTube para alam
So
nila.
siya, focus siya solely sa yung parang career guide ba? At saka parang motivation din. It's meant to inspire nurses like us.
Saka if you will check her channel, guys, you will see there yung sa OET and also sa RCSI, yung NMBI application. Makakatulong talaga yung mga vlogs ni Ate Jack. Kaya please don't miss subscribing Sweeter Than
Thank
Honey
you.
on YouTube, guys. Okay?
Meron din akong page actually mon sa Facebook,
Okay.
Sweeter Than Honey din.
Okay din.
Pwede rin
estimated.
kayong mag-message sa akin doon. So, masagot ako guys.
Ate Jack, thank you so much for your time. And I really hate to end this kind of conversation kasi napaka-valuable yung mga sinabi mo, especially on sharing your experience being a community health nurse. I appreciate
Salamat
that.
mo sa opportunity. Thank you.
Ate Jack, once again, thank you so much. Please support my good friend's channel, Sweeter Than Honey. And of course,
Thank
follow
you.
her Facebook page as well. Makakatulong yun, guys, especially sa mga aspiring nurses just like you. And once again, guys, thank you so much for tuning in and watching this video. And please comment down below kung ano pang mga department na gusto nyo i-discuss. And once again, my name is Nurse Raymond, your Pinoy nurse here in Ireland. And I'll see you on my next video. All right, bye!